Now in this PowerPoint, we're going to discuss localizing and treating a feeder vein to a spider complex that is not superficial. As you'll see in this PowerPoint, this vein that causes a spider complex is secondary to a branch of a previously ablated GSV. We'll show you some tricks on how to localize this and how to treat this feeder vein, which is necessary really to disrupt the flow into the complex. Now, many vein clinics only ablate the saphenous vein and have no idea how to address cosmetic issues. This patient had a saphenous ablation, was very unhappy she had no regression of her spider veins, which she was told she would have. This clinic did not treat spider veins with sclerotherapy. Hence, she sought out 2 other clinics in order to have this treated. She saw us, and we did an ultrasound which revealed partial recanalization of the saphenous veins. Now, we're going to show you our technique for treating this complex. It's very simple to do. And in fact, it had been treated at the time of her original ablation. She had no issue at all. Now, in this case, we will treat the spider veins using retrograde injection of Sotrodeco 0.1% foam. We will localize the branch by ultrasound, as you'll show you later, and actually a microflebectomy will be done to ensure interruption of the inflow. The foam itself may or may not be enough to cause obliteration of this vein. It's a little bit larger than a normal reticular vein. Now we're going to today inject all this stuff. We're going to use a little bit of foam to trace where it's coming from. She's had a previous ablation at another place. And, she still has all this stuff here. Here, we're going to a little bit of laser up here. We're going to inject foam. Then we're going to trace it back and see the origin. You really don't see it with the vein light. We can't trace this with a vein light. This one we can see here. So we'll inject the foam here in a minute. Now, a trick to doing sclerotherapy is to bend the needle at about a 30-degree angle. This allows easier access into the spider vein. You want to be almost parallel with the vein when you insert the needle. It takes a couple of weeks, but after about 2 weeks, if you've never done sclerotherapy, you'll be very proficient at that time. It's not that hard to do. Sometimes injecting foam's a little bit harder. However, it's the same principle as doing the liquid. So when you insert the needle into the vein, you apply minimal pressure to the plunger of the syringe. Now, you may need to pull it back just a fraction. When you see the foam or liquid starting to clear the vein, you stop at that point and inject as much foam or liquid to clear the vein as possible. Now, we're going to inject 0.1 foam. You can see nice clearance there. I'm going to put a little bit right here. Now, we're just going to see where this goes with the ultrasound, and I'll show you that in a second. Now you can see right here is the foam in a little branch. I'm going to actually just mark this with a paper clip. You can see the paper clip's right there. Okay. Now, here is the paper clip. I showed you an ultrasound marking it. So right there is what we're going to do. Just a little phlebectomy to divide that branch. You can see here how much better this looks already. So this just shows you one way to trace this back. This actually goes into the part of the GSV that's partially recanalized. So this is where we'll do our little nick. Take this out, then we're going to treat. Here's the branch right here. It's actually the etiology of this complex. So we're just going to divide the branch and let it retract and
take out about an inch or two of it if we can. Okay.
Now, this patient's had excellent clearance of the spider veins after injecting the dilute foam. There is no need to flush this complex since there is no acute thrombus present. You can hardly identify the veins that we injected. The vessel walls are in apposition. This is a great result. Remember, always use your pool noodle compression post-procedure.